Hello, thank you for participating in this project to understand how we can integrate tobacco cessation within HIV care. Good morning, good afternoon, good evening from wherever you're watching from. We'd like to acknowledge our partners and funders in this project. This study is a partnership between the Kisumu County Ministry of Health, the Kenya Medical Research Institute, and the University of California, San Francisco. The National Authority for the Campaign Against Alcohol and Drug Abuse, NACADA, and the Ministry of Health are also collaborators in this study. Funding for this study is provided by the U.S. National Cancer Institute grant. Several slides were adapted from the UCSF Treatment for Change Tobacco Dependence Education. The objectives of this module are to 1. Review the data of tobacco use in Kenya. 2. Review the impact of tobacco use on health, specifically on the health of people living with HIV. 3. Review the concepts of nicotine addiction, including withdrawal symptoms. 4. Provide clinicians, that is you, with information on how you can integrate a brief tobacco cessation intervention into your HIV care practice. On to our first topic, which is tobacco use in Kenya. There are many methods of tobacco use. You can smoke, and that includes a range of products, the most common being cigarettes. You can also chew or snuff smokeless tobacco, and you can vape tobacco and nicotine through electronic cigarettes. In Kenya, between 11% and 13.3% of the adult population use tobacco. That represents approximately 2.5 million adults. Men use tobacco at a much higher rate than women. Most of the Kenyans who use tobacco use smoking tobacco products, especially cigarettes. But 3.6% of the adults use smokeless tobacco products. Of those, 40% use or chew oral tobacco, meaning they place tobacco in their mouths, and 49% put tobacco in their noses. The majority of people who smoke every day, and 23% of people who smoke cigarettes with a menthol flavor, a proportion that is higher in women than in men. Menthol cigarettes have additional harms when compared with non-menthol cigarettes. When you're looking at the health consequences of tobacco products have toxic ingredients that cause cancer and other diseases. Among the ingredients in tobacco smoke, we have the gases, for example, carbon monoxide, hydrogen cyanide, ammonia, benzene, and formaldehyde. Among the particles in tobacco smoke, we have nicotine, nitrosamines, lead, cadmium, and polonium. We know that smoking harms nearly every organ of the body and is the cause of a large number of diseases. We also know that quitting smoking has immediate and long-term benefits. Research demonstrates that smoking the so-called light cigarettes, as determined by a machine that measures tar and nicotine, have no health benefits. And the list of diseases caused by tobacco go beyond lung cancer and heart disease, and in fact continues to expand. Here, we see all the organs that are harmed by smoking. We also know that exposure to tobacco smoke, also known as secondhand smoke, also causes harm in adults and in children. In adults, some of these harms include stroke, nasal irritation, lung cancer, and heart disease. And in pregnant women who are exposed to tobacco smoke, it could lead to a low birth weight. In children, exposure to tobacco smoke may cause sudden infant death syndrome, middle ear disease, impaired lung function, and lower respiratory illnesses. There are no levels of exposure, and that is why only 100% smoke-free environment protect health. I repeat, there are no safe levels of exposure. So, separating smoking and no smoking areas in the same space is not effective. In addition, there are additional harms caused by tobacco use to people living with HIV. We know that the prevalence of tobacco use is higher in people living with HIV. We also know that people living with HIV have greater morbidity and mortality from a range of causes when compared with people living with HIV who do not use tobacco. Specifically, people living with HIV who use tobacco have higher odds of developing several types of cancers, pneumonia, chronic obstructive pulmonary disease or emphysema, cardiovascular diseases, infections, including tuberculosis and HIV-related infections. They also have higher odds of progression from HIV infection to AIDS. Importantly, people living with HIV who use tobacco have a poorer response to antiretroviral therapy. Here in Kisumu, some of the leading causes of death, such as cardiovascular diseases, are known to be negatively impacted by tobacco use. On to our second topic, tobacco control in Kenya. Kenya has made great progress in tobacco control and has taken several steps to regulate tobacco use in the country and support cessation. Legislation and regulation in Kenya have mandated that health warnings on tobacco packs be accompanied by pictures. They have created smoke-free environments in public places, restricted marketing and advertisements of tobacco, and continue to work on taxation to prevent people from starting tobacco use. In 2017, the Ministry of Health launched the National Guidelines for Tobacco Use Cessation, and this project is trying to support implementation of these guidelines. In addition to the National Guidelines for Tobacco Dependence Treatment and Cessation, the 2018 Guidelines on Use of Antiretroviral Drugs for Treating and Preventing HIV in Kenya also includes a recommendation that tobacco dependence treatment and cessation be incorporated into HIV treatment. We do know that some adult tobacco users in Kenya may just need some support of a provider to make the quit attempt. 39% of smokers tried to quit the year before, and 29% of smokeless tobacco users made a quit attempt. Only 37% of the tobacco users that saw a healthcare provider in the previous year received advice to quit. Thus, 63% of people saw a clinician and received no advice. But advice to quit is positive. Of those who did receive advice to quit, 93% considered quitting. Considering quitting is a great first step. We also know that concern for their own health was a motivator when thinking about quitting. It is important to remember that tobacco dependence is a two-part problem. There is a physiological component, which is represented by addiction to nicotine and treated with medication, and a behavioral component for which treatment is advised to support behavioral change, meaning attempts to quit and quitting. In this arm of the project, we are really focusing on the behavioral component because we do know that advice to quit from a health provider can be a powerful motivator for cessation. On to the third topic, we ask ourselves, so what are the benefits of quitting? In this video, we'll see that the benefits start almost immediately and grow over the years. I hope you've noted that quitting tobacco use has health benefits at any age. We look at the biology of nicotine. So one of the reasons why people have difficulty quitting is that tobacco users are addicted to nicotine. Nicotine is not just a bad habit, it is an addiction. Nicotine stimulates dopamine release, leading to pleasure feelings, which in turn leads to repeated administration, meaning you will have more tobacco use and tolerance develops. So the person uses tobacco to a level that continues to produce dopamine release, therefore creating this cycle of addiction. When people quit tobacco use, they often suffer withdrawal symptoms. Some of the withdrawal symptoms include depression, insomnia, irritability, anxiety, difficulty concentrating, restlessness, increased appetite, weight gain, decreased heart rate, and cravings. Of note is that most of these symptoms will subside within 2 weeks. When you're looking at tobacco dependence treatment, it is important to take note that tobacco dependence is a chronic and a relapsing condition. Somebody will therefore need repeated intervention for them to have a positive and successful quit attempt. There's different medications for sedation, but in this arm of the study, we are testing the brief intervention only. Therefore, the focus is on behavioral change, including the use of the helpline. At the end of the study, you will have additional education opportunities on medication that support tobacco dependence treatment. When you're looking at the brief intervention, the focus will be on the 5 A's. The 5 A's stands for, first A is ask, where you're saying, ask about tobacco use. The second A is advise. You need to advise tobacco users to quit. The third A is assess. Assess readiness to make a quit attempt. The fourth A is assist. Assist the patient with the quit attempt. And the last A is arrange. Arrange for follow-up care. For this arm of the project, we'll be focusing on the three brief intervention techniques, which is ask, advise, refer. So you will ask all the patients about their tobacco use. You will advise all the patients about the importance of quitting. Then you will refer them to resources available, including the helpline. At the helpline, they'll be able to be supported or assisted with quitting, and the helpline will arrange follow-up. When you're asking about tobacco use, you need to use a tone that conveys sensitivity, a tone that conveys concern and is non-judgmental. For example, you could ask, do you smoke or use other types of tobacco? And because patients may be worried about why you want to know about their tobacco use, you could ask or explain, we ask all of our patients because tobacco use can affect how some medicines work. When you're advising, you need to use clear, strong, supportive, and personalized messages. For example, quitting smoking is the single most important thing you can do to protect your health now and in the future. When you're assessing readiness to quit, for most patients, they might be ready now, they might not be ready the next time. But every time you have to ask, are you ready to quit? When they say yes, you ask, do you think you can quit successfully? When they say no, you evaluate the reasons why they feel they cannot quit successfully. You provide encouragement and support. When they say yes, you congratulate them on the decision, and then you provide brief counseling and refer to the helpline. For those who answer no, when you ask if they are ready to quit, you engage them in counseling. When talking to those who are not ready to quit or feeling not confident in their quitting, some of the counseling strategies, the do's and the don'ts. Under the do's, we are suggesting you strongly advise to quit, provide relevant information, ask non-invasive questions where you're trying to identify reasons for the tobacco use. You need to raise awareness of health consequences of the tobacco use, demonstrate empathy, open the door for communication, and leave the decision up to the patient. Things not to do. Do not persuade. Do not cheerlead. Do not tell the patient in a judgmental manner how bad tobacco is for them. And do not provide a treatment plan to someone who is not ready to quit. We will refer all the tobacco users to the toll-free telephone helpline 1192. This helpline is being managed by NACADA, and the counselors who manage the helpline are trained and they're ready to provide the support that is needed for the client. As a clinician, ensure that you will ask all of the patients about their tobacco use. Document this in their chart even when you have referred them, and this will help to support the patient in their future quitting attempts and during their visit. During the next visit, when the patient comes, you will ask again, are you using tobacco now? If they're using, it means they are relapsed, then you encourage them by letting them know that relapse happens. And you encourage them to try again to make a quit attempt. When they say no, they are not using, you congratulate the patient, you offer them support, and you remind them that the helpline is available. Thank you very much for watching. You're welcome to watch this module as many times as you want. You can bookmark it on your computer or your phone. Helping to address your patient's tobacco dependence is a significant component of their HIV care. You can make a difference with these simple steps. Ask about tobacco use, advise tobacco users to quit, and refer them to the helpline. Thank you very much.